Okay, Amy, good if we get started?
Sounds good, Eric.
Great. Uh, Thanks everybody for joining the call today. I have a number of things we want to cover with everybody regarding our insurance plans and our open enrollment period, which is starting on Monday. We've got some changes this year, different from in years past, that we really need to go through and make sure people understand as best as possible. So, want to get started? We'll go start with introductions. I know there's some familiar names so far on the people that are on the call, but many I don't know. So, my name is Eric Herpich. I'm the Associate Vice President for Human Resources. Ashley, I'll let you introduce yourself.
My name is Ashley Young. I'm the new manager of benefit services. I'm over benefits, workers' comp, and leaves of absences. I've been here about a year and a half, so still new. And then I'd also like to introduce Erica, if you want to wave for everyone. Erica Lamb is our from our broker, so she's here to assist in answering any questions that people may have at the end as well. Hold on just a second. We also have my team. So Pam Fritz is our senior benefits and leaves analyst. She has been with the university for over 20 years. And then we have Monica Haynes, the senior benefit and compensation analyst, who has also been with the university for over 20 years. There's a lot of tenure there. And we have Jessica Briggs, and she is the newest member of our team as our benefit coordinator, and she's been a member of our team since this year. And so we're all eager to help those who have questions or with anything that you need to get through open enrollment.
Super, thank you. So we'll just kind of run through the agenda of what we're going to cover today. We're going to talk about the open enrollment dates for the 2026 benefit year. There are changes to the priority health plan that we're going to run through today, as well as go through the medical rates for all the plans. We're going to talk about changes to the vision plan, which we have changes to our vision plan offerings for 2026 as well. So we'll talk about what that means. We'll just touch briefly on the dental plan. There's no changes there, but we'll just kind of touch on that. We'll talk about the flexible spending accounts, key dates and reminders related to those flexible spending accounts, and then just talk about key dates and support from the benefits team for the faculty for open enrollment this year. So just talking about open enrollment dates, open enrollment begins on Monday, October the 20th. It will run through midnight on Friday, October the 31st. Any changes made during open enrollment will be effective January 1 of 2026. And take note of the health and wellness fair, usually it's a great event. We have a lot of benefit providers and I think we're doing flu shots again this year, but a lot of opportunities to meet and talk with folks regarding benefits. It's going to be over in the rec center as usual from 9 a.m. to 1 p.m. And again, we'll have representatives from Priority, from Blue Cross, from Delta, TIAA, all the benefit vendors will be there. So it's a great event. So please stop by if you have questions or just want to check it out. That'd be great. So let's talk about the priority plan and the changes that have taken place. Late in 2024, Priority made the decision that they were going to eliminate the Healthy Choice plan, which is the plan we've been utilized for many, many years. There were a handful of employers that were still using that Priority administered the plan for. They have terminated that plan for all employers that were using it, including Oakland University. And if you're familiar with the Healthy Choice plan, that basically is a plan that you accumulated points for different healthy activities or initiatives, and that would qualify you for a set of benefits, whether it was the choice level of benefits or the standard level of benefits. And that, as I said, plan is no longer going to be an option for us. So human resources have met with the employee groups during the course of 2025, trying to find an alternative plan that was hopefully the best option we can come up with, considering plan coverage, costs, and all those different factors. And I think we came up with a really good plan to offer our faculty and staff here. So the plan itself, though, will be a single HMO plan. It won't be divided up based on those qualifying standards. So it will be a single HMO plan. It basically has the choice level of benefits as it relates to deductibles and coinsurance. In other words, there are no deductibles or coinsurances out of pocket. So that is one part of the new plan. There are slight increases to some of the copays, the office visit copays, and the emergency room copays. Those have increased slightly, and we'll talk about that on another slide. And I'm sorry, just go back, Ashley, for a minute. And then, as I say, it's a standalone plan, so there's no qualifications or criteria that needs to be met. It's just a standalone Priority Health HMO plan. So this is a slide that shows side by side the breakdown of the 2025 benefit plans. And again, it shows the choice plan. So if you qualified for choice in 2025, you had a plan where there were no out-of-pocket deductible costs for you. There was no out-of-pocket co-insurance costs for you. You had the $20 copays for office visit, urgent care, any therapy services you were using, chiropractic care, et cetera. So those office visit copays, if you were on the choice plan, were set at $20 per, and the emergency room copay was set at $100. If you did not qualify for the choice plan in 2025, you would have been placed on the standard plan, which had out-of-pocket costs for a deductible of $200 for single coverage, $400 for two-person or family coverage. You also would have, after that deductible was met, you would have had co-insurance costs out of pocket at an 80% 20% split, up to a maximum of $2,000 for a single person for a year, $4,000 a year for a two-person or family contract. And then you can see the copay differential. The copays for the standard plan were $30 per, and the emergency room copay was set at $150 for that service. So we go all the way to the right, the column to the right, that is the new 2026 Priority HMO plan. You'll see there are no out-of-pocket costs under the deductible section. There are no out-of-pocket costs under the co-insurance section. And as I said, the copays did increase from $20 if you were on the choice plan up to $30. If you were on the standard plan, there's no change to those copays. The emergency room copay will be set at $150, but all those copays are set at $30. So again, if you were on the standard plan, there'd be no change. The copays are going to be the same. If you were on the choice plan, you're going to see that increase from $20 to $30 on those copay amounts. So what does this mean for you? What it means for you is if you're on a priority plan in 2025 and nothing is changing for you, in other words, all your dependents are going to stay the same, there's no one that's coming off your plan or no one that you need to add to your plan, there's really nothing for you to do. We're going to automatically move you to the new priority plan unless you want to do something different. So if for some reason you want to move to a Blue Cross plan, then you'll need to talk to someone on the benefits team to make that move. But if you're on priority in 2025, you want to move to the new priority plan in 2026, we will automatically do that for you. There's going to be nothing for you to do. If you're opting out and you want to elect to join the priority plan, you'd have to obviously talk to someone on the benefits team and enroll during open enrollment for that. Priority will be issuing new insurance cards for the 2026 benefit year. So hopefully, sometime in December, the expectation is that Priority is going to be issuing those new insurance cards for that new plan that's going to start on January 1st of 2026. So we want to talk about rates. Obviously, that's important to everybody is what are the costs. So what we've done here on this slide is we're showing you the 2025 rates for the single, two-party, and three or more for Priority. In 2025. You'll see if you move over to the right under the 2026 spreadsheet, you'll see the rates for the single, two-party, and three or more for 2026. So you'll see the increases there. And, normally we see increase in rates due to inflationary costs, but those rates have increased. And you see the difference there between the priority plan this year and the priority plan for next year. We do have to talk about Blue Cross. These are not misprints on these numbers. When you look at, if you're currently on Blue Care Network, you'll see a significant cost increase for that HMO. If you decide you're there now and you want to stay on that Blue Care Network HMO, you'll see a sizable increase to the employee's contribution on a monthly basis for Blue Care Network. And for the Blue Cross PPO, if you happen to be on that coverage and you want to stay on that coverage, you'll see an even more significant cost increase to the Blue Cross PPO numbers from 2025 to 2026. So I would just encourage everybody to just research obviously what your medical needs are for you and your family. Look at obviously your budget and the cost structure, and you need to make the decision that's best for you, but understand those numbers. And again, I would encourage folks that are on those Blue Cross plans to come to the benefit fair. There's going to be Blue Cross representatives there. There's going to be priority representatives there. I think it'd be important for you to understand the differences between those plans so you can make the best decision for you and your family for 2026. So vision plans changes. This has been a little pet project of mine since I started here. We have had two vision plans for some time, one through Davis Vision and one through Blue Cross. Those plans provided vision coverage and benefits on basically a 24-month basis, and it was driven by date of service. So I guess from my experience anyway, it just seemed to make more sense. Let's just have one single vision plan. Let's have the vision plan offer benefits on an annual basis, so you don't have to have this process of employees having to switch back and forth between two different plans. So we are going to have a Delta Vision health plan for 2026. It will be the only vision plan for 2026. Most of you are familiar with Delta as it relates to your dental coverage because Delta has provided dental coverage here for some time. Delta is now in the vision business, and they utilize the VSP network, which is probably one of the broadest network of vision providers in the state of Michigan, which is a great benefit to all of our faculty and staff. So this change will be, again, a single vision plan. It's going to be offered through Delta Vision. Eligibility will renew every January of each year. So it's not going to be date of service driven. It's going to be calendar year driven. So conceivably, you can go for an eye exam in October of 1 year, get glasses as an example if you wanted to in October, and then beginning in January, your benefits start up all over again. So in February, you can go and get contact lenses, and your benefit eligibility for that year will start over in January. So you can get the benefits on that kind of a schedule if that's what you're interested in doing or what you need. We've increased the annual benefit allotment for frames and contact lenses. That used to be $105 for frames and for contact lenses. We've increased that benefit amount to $130 for frames and contact lenses. So that's an enhancement of the benefit we've got under our vision plan. And as I said, access to the VSP Choice Network through Delta Vision. Again, one of the broadest networks available, so coverage issues should be minimal. And another benefit is that we're now going to have you folks as faculty and employees here, as well as the HR department, will have our vision and dental benefits on one online platform. So if you want to, access or get information regarding your dental benefits or your vision benefits, you can go to Delta for information on both of those through one single source. So again, another benefit there. So this schedule just shows the increase. You can see the contact lens increase, $130 allowance there, the frame allowance at $130. So this just talks about those coverage levels as well as the every calendar year frequency of the benefits are also outlined in this schedule. So what does this mean for you as it relates to your vision plan? If you are on Davis or Blue Cross in 2025, we have already moved you over to the Delta Vision plan effective 1/1 of 26. So there's nothing for you to do. You will automatically be moved over to the Delta Vision plan. In fact, we've already got that done in our system. So, but please take note if you are having changes in your dependents, if you're adding a dependent, deleting a dependent, if you've opted out of vision coverage for some reason and you want to opt back in, you do have to, during open enrollment, talk to someone on the benefits team and make those changes during the open enrollment period. Vision cards aren't required to seek services. Usually your vision your vision provider is going to ask for your name or social number and look up your benefit levels directly. But if you do want to print a vision card, you can through the Delta Vision website. You would be able to print out a digital card if you were interested in doing that, but it's not required to get services through the plan itself. And then we just want to just touch on this just because we're talking really about, all the different benefit offerings that for the dental plan for 2026, there really aren't any changes. So there's nothing for you to do there. The dental plan is still going to be offered through Delta. The benefit levels are all going to be the same. So again, nothing to do as it relates to your dental plan for 2026. And I'm going to turn it over to Ashley. She's going to talk through some additional information here.
Okay, thank you. So I just wanted to go through some key dates and reminders for FSA in general. FSA accounts do not roll over from year to year. So if you are interested in an enrollment for the 2026 plan year, you will have to log in and enroll or re-enroll in that plan through the Open Enrollment platform. And then healthcare FSA as well as dependent care FSA, those accounts are completely separate. So if you're interested in both, you'll have to enroll in both of them. The 2026 plan contribution amounts or max contribution amounts are listed. So for the healthcare FSA, 3,300 is the max contribution amount for 2026. And for the dependent care FSA, 7,500 is the max contribution amount. The healthcare FSA does have a run out period, and that ends on March 31st of the following plan year. So for healthcare claims incurred in the current plan year of 2025, you will be able to send in your reimbursement requests and up until March 31st. If you want to put those on your calendars, that date on your calendar so that you're aware and you're doing what you need to do to get those funds back. And then unused 2025 healthcare FSA funds in the amount of 25 to 640 will carry over for 2020 into 2026. And this will happen mid-April. So that's another date you probably want to put on your calendar just so that you're aware. It is, mid-April. So it won't happen right at the beginning of the year, but it will roll over. And then we do try to notify those with the FSA accounts once that happens, once we've been advised. And then just want to go over some support and resource information so that, again, the Benefit and Wellness Fair is on October 22nd, which is next Wednesday. And we will be there, the benefits team, in full force from 9 a.m. to 1 o'clock p.m. And that's at the rec center. So we hope that as many of you have the opportunity will join us. And like Eric said, you can also speak to the carriers that are there too. We do welcome walk-ins during open enrollment. So for the 2 weeks, Monday through Friday, 8:30 a.m. to 10:30 a.m. And then again, 2:30 p.m. to 4:30 p.m., with the exception of the Wednesday that we will be at the wellness fair, health and wellness fair. We do welcome walk-ins. Please just understand that we are assisting all employees, faculty and staff members that are benefit eligible for open enrollment during the same 2 weeks. So we do ask for some patience and grace while we get to everyone and give them the attention that the individual attention that they need. It is highly recommended that you do schedule an appointment if you have specific questions or would like the independent attention or just need help enrolling. There is a link available on the benefits and compensation ERN that you can see currently where you'd be able to go in and schedule a virtual appointment. And if those dates and times don't work, you can call the benefits office. You can also send an email and we will find time we will follow up with you and then find time that works within your schedule to get the help that you need. Understanding, during business hours. We also just want to make sure again that if you walk in and our doors are shut, if you want to wait in the front patiently in the front of the HR floor, we will come and greet you when we're available after those that we're meeting already. And then just be patient with us and give us the time so that we can give everyone the same attention through the process. This would be next steps. So it would be important for you to view your current benefit enrollments on sale on your benefit summary. You can also review the benefit guide on eSpace through the ERN. And on the note on the ERN as well as in eSpace, there are detailed instructions, step-by-step instructions that will help you to view your current benefit summary as well as your benefit summary after you have completed your enrollments if you do go through the open enrollment process. Plan for any changes that you would like to make for next year. And then a reminder that October 20th through the 31st is open enrollment. So if you would like to make any changes or need to enroll in the FSA accounts for the 2026 plan year, you will have to do that through the open enrollment platform. If you do not have the need for FSA and you don't want to make any changes, there's nothing that you have to do and you would be all set. And then again, just attend the health and wellness fair so that we can meet you. You can meet us in person. And then that is October 22nd, 9 to 1.
So Ashley, I'm sorry, and just to confirm, I know FSA teams tends to trip people up. So
Mhm.
if you are already in the FSA and you want to continue the FSA, whether you want to keep the same deduction or change your deduction amount, you do have to do that during open enrollment. Or if you're newly participating in the FSA, you need to do that during open enrollment.
Correct. FSA does not roll over.
Gotcha.
So
Thank
those
you.
would have to be done during open enrollment.
Thanks.
And then just to recap, we discussed the 2026 open enrollment key dates, the changes to priority health, as well as the increase in medical rates, changes to the vision plan, the dental plan overview, FSA key dates and reminders, and then next steps. We'd like to open it up for any questions. I saw some in the chat. So Erica, were there any outstanding?
I think Amy's gonna walk through
Oh,
those.
Amy's doing it. Okay.
I do. I had just a couple that I'd want to run through, and then we can go to everyone who else has questions. Um, One that I know is a big one is why is Blue Cross Blue Shield? Why are the Blues so expensive?
Yeah. So this is the rates for all of our plans are claims driven. So what the health providers do is they will look at the population that they are insuring and look at claims data as far as what kind of healthcare needs for the people that are covered and what the cost for those healthcare needs and what the anticipated costs are going to be for those healthcare needs. And that's what is going to drive the rates. There are fewer and fewer people on Blue Cross over the years. Those numbers have been steadily going down. So the claims data of the people that are on those Blue Cross plans is what's driving those rates up.
Okay. Then a question about the new priority plan. It said one of the changes is that there is the removal of the maximums. I'm not getting that right. One second.
Yeah.
Removal of maximums. What does that mean?
So what's happening with the priority plan is if you're on the standard plan, if you were on the standard plan in 2025, you had to pay out of pocket a deductible, either 200 or $400, depending on the coverage that you had. After you went out of pocket and paid those costs, the 200 or $400 for your deductible, then you had to pay for covered medical services out of pocket at an 80%, 20% cost share with priority. And your 20% was going to be is going to be tracked out of pocket until you meet the $2,000 or $4,000 maximum if you're on the standard plan. After that, then the plan is going to pick up 100% of those costs. So that's only if you were on the standard plan. Do those deductibles and coinsurances come into play? And those will not come into play in 2026 because there are no deductibles and coinsurances on the single plan that's being offered for 2026. So if you were on the choice plan, it all looks and functions the same. But if you were on the standard plan, you were coming out of pocket for significantly more money, and then you will not be doing that in 2026 because those copays and deductibles will not apply to anybody in priority for next year.
Okay. I think you answered this, but I'm just going to ask it again so it's repeated. If you were already enrolled in vision, you're fine. You're enrolled in the new single vision plan. You don't have to do anything for vision. Okay.
Correct.
What if, and you might have already said this, what if you were enrolled in one of the priority plans? Do you have to enroll in a new priority plan?
No, if you're already in the priority plan, you will automatically move over to the new priority
Okay.
plan unless for some reason you want to go to a Blue Cross plan. So if you're in priority and you're staying with priority, you don't have to do
Okay.
anything other than if you maybe have a dependent change. If you're adding a
Right.
dependent, deleting a dependent or something like that, then yes, we need to make sure that change is made during open enrollment. But if everything's the same and you're moving from priority now to priority in 2026, you don't have to do anything.
I think we know the answer to this one too. For the Delta Vision, does it include the annual eye exam?
Yes.
Yeah.
There's
Okay.
I think there's a $5 copay if I went back to that screen. I think it's a $5 copay for an eye exam.
Okay. And then can you explain the differences as best as you can between the Blue Cross Network HMO and the Priority Health HMO?
Sure. Well, Probably going to look at Erica here a little bit too. But so there's obviously differences in network. The Blue Care Network obviously is a comprehensive network of providers. I don't know if Priority has the same broad network of providers, but it's a pretty good level of coverage between the two. I do know one of the major differences is Priority functions on more of an open network. So where HMOs traditionally you would go to your primary care doctor and then get a referral to a specialist, and I believe that's the way the Blue Cross plan still operates. Priority does not operate that way. As long as you're seeing someone in network, you don't have to go through that referral process. And I'm going to let Erica kind of jump in if there's any other differences that are important to understand between Blue Care Network and Priority.
Nope, those are definitely the main differences. Obviously, some providers are going to choose not to participate in one network or the other, but all the hospitals in Michigan participate in Blue Cross and participate in Priority Health, and wide network of providers, especially in like the Tri-County area. So Macomb, Wayne, and Oakland, even going into like Lapeer. Priority Health has a very strong network out west. They're headquartered in the western part of the state of Michigan. So very, very similar networks, and all of the hospitals are in network between both carriers.
This is the thing you want to check with your specific doctors on, because I definitely did have a couple people who have to stay on Blue Care Network with particular doctors because they won't take Priority Health.
Yeah.
So making those phone calls to find out what your doctor takes. Diane.
So I have a question about I was looking at the materials that came out this morning, and I have a question about page 1, if anybody has that. It's the 2026 contributions for the medical premium rates, and there's a couple small paragraphs underneath in small print, and I'm particularly asking about the second paragraph. And it says, the lowest cost HMO plan calculation for AAUP faculty is the Priority Health closed formulary HMO plan. I understand closed and open. It's not my question. AAUP faculty members will maintain access to the Priority Health Open formulary plan, but the employer-employee premium calculation will be based on the premium charged for the closed formulary plan. And then it says the rates for the closed formulary plan are, and it gives lower rates than what are in the chart. What am I missing?
Amy, do you want to answer that, or?
I mean, it's giving the numbers for the closed formulary. That's what our 10% is based off of. Our 10% is not based off our open formulary.
So the 8969 is
So
not 10% of 746. It's based on, okay, got it.
I would say that the 90% is based on Oakland University's contribution is based on those rates at the bottom paragraph, and then you are paying the difference for each plan.
Okay, got it. I have another question, a little more detailed. Do you know if I've had a situation lately where my old insurance, my eye insurance, visit insurance was not paying the refraction fee? Do we have any idea if the new Delta Vision actually pays? I've had a number of different ophthalmologists with different people, and they don't pay the refraction fee. You end up paying that yourself.
Yeah, I'm not sure we can answer that question yet, but we'll definitely go back with the provider and look and see whether that's covered or how it's covered, and we can let Amy know as far as maybe a follow-up post to maybe this and maybe some other questions that might pop up.
That'd be great, because it's like $50.
Sure.
Yeah,
we'll definitely get that answer for you.
Thanks. And then the last question I have. With the flexible spending account, the healthcare, if the money, I know you said it doesn't roll over, it doesn't renew, the money rolls over, right? So you roll money over a few $100 and you can't access that money until April. So what happens if you have a major medical expense in January, February, or March? And all you've done is roll over. Is the idea that you need to put in fresh money to have money for January, February, March?
Erica?
So you would still be able to submit for reimbursement for claims that have dates of service beginning January 1st. It's just those funds aren't available. So you just have to wait.
You pay it up front and then you get reimbursed. Okay, great.
Correct.
Thank you.
Someone just asked in the chat and it was answered, but I just want to have you guys say it out loud. So for people watching it back later, do you have to still do the annual physical in the first 3 months of the year?
Yeah, if you're on priority, none of that applies any longer. I mean, you do your physical whenever you want to do your physical. It's not a question of getting your physical to accumulate your points. That all is gone from the priority plan.
But Blue Care Network will still have it.
Yeah, thanks for that, Amy. That's actually an important point. Yeah, to just as a note or a reminder, if you are on the Blue Care Network HMO plan, that still is a Healthy Blue Living plan. There is the qualification factors that went into you qualifying for, I think they call it enhanced and standard, I believe. That's different terminology. But for you to qualify for one of those two levels of benefits through Blue Care Network, that has not changed. That is still the same. It is only priority where those requirements are going away. Yeah, thanks for that, Amy. That's a good point. I'm glad you mentioned that.
If I missed anyone's question in the chat, feel free to repost it. I tried to go through. I think I caught most of them, but other questions?
I have a question. This is Jyoti Raman. Following up on Diane's question about the availability of particularly the healthcare FSA, if you did contribute, would that be available in January?
Yes, if you started a new contribution, if you enroll during open enrollment and you have new contribution, that will start with your first, it will be available at the first of the year.
It's only the rollover that's available in April.
Correct. Yeah. And that'll add to your total.
Correct. Second question is Davis Vision. Now, do I have to call the people I go to check if they are accept Delta Vision?
You should. I mean, yeah, you definitely should call your vision provider and confirm that or ask whether they're taking, the VSP through Delta Vision. Your Davis Vision coverage will still be in effect through 12/31 of 2025. So if you want to get service or you want to get glasses or something, contact lenses before the end of the year, you'll still be covered by your Davis plan. And then 1/1/26, you'll be switching over to the Delta Vision plan.
Could I safely assume that if they were accepting Davis, most likely they would take Delta?
No, the Davis network is definitely narrower than the VSP network. So it's probably likely that if someone took Davis, they're probably going to take the Delta Vision through the VSP network. But you definitely want to call them directly and confirm that. That's the best way to confirm that you're going to have coverage, or your provider takes that Delta Vision coverage through VSP.
Okay, I do have a third question, but I don't want to take up all the time. I can wait for my third one in case somebody else.
We still have like 25 minutes,
Jyoti. Yeah.
Okay, this is my question. So my husband, who is my dependent, will be on Medicare from December. So for next year, I need to enroll him just for the vision and dental?
That's up to you, depending on your individual situation. We do have individuals who are Medicare eligible and maintain the Oakland University coverage. Individuals are spouses as a supplement. But if that's not desired, you'll want to speak with an insurance representative to get guidance there. It is an option though, so that would be completely up to you.
And what about, I did ask this question, but I didn't quite understand it via email about the fact that can I enroll him from the current year coverage for December and get refunded?
If depending on, and I'm sorry, I don't remember what you said his birth date was, but depending on if he has a status change event or qualifying life event that would open it up for you to change coverage, those have to be done within 31 days of the event. But if he doesn't have an event, which in your case would be him being newly eligible for another coverage in this year, then you're going to default to the open enrollment.
I did get an email reply saying that I could get reimbursed as long as I fill the form. So I had two questions. One is his birthday is 12/20 of December this year. And I was told that I have to fill the form. First of all, which 31-day period? Is it from his birthday or is it from open enrollment date?
I'm sorry, Ashley, kind of a second. I'm going to make this suggestion. I'm going to suggest that anyone that has a question that's really personal to themselves or their family member, to come, make an appointment or talk to someone on the benefits team offline. I think that's probably going to be better for you to talk to someone directly with your individual circumstances so we can research that and answer your question. I think it's going to be the best way to probably try to address that.
Sounds
And I know
good.
you said that you had reached out, so I'll look back at the email. If all the details weren't in there, we maybe were giving a general response, so we can look. I have the birth date, so I can respond based on that.
Okay, wonderful. I'll see if I can email you directly, Ashley.
Sure.
Very good.
Thank you.
Helen?
Eric, I think you may have answered my question about the Delta Vision VSP. It is a VSP plan, correct?
Correct. Administered by Delta.
That's what I thought, because
Yes.
there are some providers who only take VSP, so this would qualify. Right?
Again,
As long as
go ahead.
As
Go
long
ahead.
as they're in what's called the choice network. So VSP has like different network names. There's the VSP choice network, which is their broadest network, and it's the same network that the Blue Cross Vision plan used. So as long as they are in the VSP choice network, then they would be considered an in-network provider.
I see. Okay. Thank you.
You're welcome.
Ken, I'm not sure that's the right link. Ashley, can you check the chat?
Looks like a Davis Vision link.
Yeah, that's Davis Vision. We're switching to Delta, which is VSP. So that is not the correct link for 2025, so 2026. You might have already explained this, but why is the rollover money not accessible for 3 months? 4 months?
So the plan has a run out period. And so you have 90 days from the end of the plan year to submit for reimbursement for dates of service through the end of the plan year.
Gotcha.
So if you don't, so they have to kind of keep those funds available in case you submit a receipt. So that's why, for the run out period.
Who in benefits should we be talking to about investment stuff, retirement money stuff?
Yeah, so you're gonna call TIAA because they're our record keeper for our 403B plan. So you want to call them directly with any questions you have about your contributions, your investments, or your retirement plans. Call TIAA. They will also be at the benefits fair. So if you want to stop by the benefits fair, you can ask questions there of the TIAA rep. And I will just say, I'm going to take a minute and just plug this. And I think everyone's aware of it, though. We have started this year a new retirement education program, which I'm really excited about. I think there's going to be some great information regarding retirement, Social Security, Medicare, all the things that I think people have questions about as they're getting ready for retirement. That plan is being offered. It's an 8-session series that's going to start later in October. There's been a couple of emails that have gone out with the dates and registration opportunities for folks to take advantage of that. So I would just say look for that information. Maybe go back to your emails if you might have missed it. If you have questions about it, you shoot me an email, shoot Ashley an email, and we can send you the information about what those courses are going to cover and how to register.
Amy, I did see there's a question about the rate sheets online, and if they're updated. We are going as fast as we can to update everything that needs to be updated on the website based on, some delays that we had with getting everything situated for this year. So those will be updated, but all of the rates are accurate in eSpace in the guide. So you can view your eSpace guide there, and all of the benefit information is there as well. It's a very detailed resource. And sometimes it's just easier to kind of digest everything when you can read it yourself in your own time. And again, the online enrollment instructions are in eSpace as well. So that's a great tool to use while enrolling.
Could you include a contact for TIA in the chat? And then is there, in the beginning of the slideshow, when you did your contact information, are your emails all there?
I don't think they are. So
Could we add those so that when I
Yeah.
send out the slideshow, it's there?
And I would say for benefit questions as it relates to open enrollment and just in general benefit questions, they're best to go through the general benefits mailbox, which is
And yeah,
benefits at Oakland.
whatever
Yep,
you want to
because
put on the slideshow, if you can put it on the slideshow, that would be great.
Super.
perfect. That way, if anyone is not present for a few days, you're not going to be delayed by that mailbox.
Mhm.
And then on page 38 of the open enrollment guide is the phone number for TIAA. There's also the benefits at oakland.edu email address. So if you don't memorize that, it's on the benefits guide, and all the contact information for all of the vendors are on that page.
Could I just say something about eSpace really quickly? I do think there were some people confused when they went to the full-time faculty eSpace because there were the different documents and they weren't like maybe one said OUAUP, and it wasn't clear that one was the 9-month and one was the 12-month. They weren't like clearly articulated. And then furthermore, if you could change the eSpace title for our OUWB faculty, I think they'd really appreciate it because eSpace for them right now says non-faculty. So if you
Gotcha.
could tag something like non-faculty and OUWB faculty, I think that would be appreciated.
Yep, you betcha.
Thanks. Diane.
I would just like to say we may have some limitations with that because this has been set up for a while this way. And I'm not sure because it's a course. You kind of have to put it out there as a course. So we can definitely look into it.
I just wanted to follow up on the retirement stuff. I know that's not what this is about, but it does seem like we're doing okay on time. Eric, I have two things. Who is running those retirement seminars? Who's the company? This isn't OU.
Sure. So the organization doing the retirement presentations is a company called One Digital, formerly known as SHA Investment Advisors.
Okay.
This is the organization that we have contracted with as our retirement investment plan advisors. So when we went to the single record keeper, they were the organization that led us through that process. They are hired to vet and create our core fund lineup. They've got expertise in obviously retirement investing as well as these other areas that they're presenting on. So we are contracting with them.
But they do sell their own product. I mean, they have their own products that they will sell for retirement, annuities, et cetera.
No. They're going to be advising you on what's available in the plan that OU has.
So what's the difference between TIAA? I mean, I'm very familiar with TIAA.
Sure.
I have someone I work with. I don't understand what this is doing that they don't do.
Sure. Well, TIAA doesn't do any investment advising on these kinds of things. If you call them and ask them a question about Medicare, they're not going to have any answers for you.
Okay.
So this is a more holistic approach to your retirement and all the facets that are part of that.
Okay.
And the reason why we're using One Digital is because they are an independent advisor. So if you talk to TIAA, I would expect them to try to steer you to TIAA products, and that's not what we're interested in. We're interested in more of an objective, covering of information.
One more question, and this might be more to Amy. There are things that are unique about retirement in our contract. There are contractual provisions in our retirement about retirement in our contract, and I'm wondering if there's going to be a session offered explaining the possibilities for retirement under our contract.
There's very little.
Well, I know, but there's
very little.
There's
but it was so I went to a couple of the meetings with One Digital, and we did sort of talk about how much are they going to know of the contract. And I think, Ashley or Eric is going to be at all of the sessions as well, to hopefully sort of field the questions that One Digital can't ask, or to be able to punt it and say, okay, we're going to have to dig into this specific piece. So they are going to be aware of, but that isn't going to be their main wheelhouse, but there is going to be Oakland people there to cover that aspect you're talking about.
I mean, we have phased in retirement and stuff, which is, a unique situation under the contract. So,
and I do want to say up front, One Digital will not be touching any university related benefit information. They are going to be talking about the fundamentals of investing. Right. They're going to talk about how your taxes, Medicare, and Social Security fit in with your retirement plan. They will not be talking about anything related to Oakland University's benefit option.
Right. But you'll be there, so you might be able to. Great.
Yep.
Thanks.
Lisa, you've had your hand up for a while.
Yeah, and maybe this is too specific, I'm not sure. It's just, I've been a type 1 diabetic for literally 60 years. And I've been on Blue Care Network for a long time, and I'm wondering, I've heard such bad things on one side and such good things on the other side, no middle ground when it comes to priority health. So I wondered if you had any experience with someone with chronic disease and the priority health chain.
I'm going to encourage you to stop at the benefits fair and talk to the priority representative or call them directly. Again, I think when there's specific questions about health, specific health diagnoses or conditions and how they're going to be applicable to the insurance plan, you
Mhm.
really want to be talking to your healthcare provider or the insurance plan representative directly.
Yeah, the problem is that if there's a number I could call, I would appreciate that because I teach from 9:20 until 1:05 on Wednesday.
Mm-hmm. Sure. Yep. Yep. So you want contact information for priority?
Yes, please.
Sure. I do want to follow up to, I think it was Diane's question or the conversation on. I know this wasn't about the retirement planning program. I did want to just plug that, but I didn't want to spend a lot of time on that. But I do want to say, Diane, that I don't know that there's going to be someone from HR at each and every session. Really, the goal of this is to provide information and direction for folks on those other areas outside of the HR benefit plan. So you'll see an HR rep at most of those sessions, but there may be one where you attend where maybe there's someone not there. So it might be a call to us directly versus getting an answer in that kind of setting.
Did we get an answer about that question I had about if you have like an adult child, could you like bring them along to some of the fundamental ones?
Yeah, no, I'm sorry about that, Amy. I did get a response that they're really discouraging that. Spouses definitely are encouraged, but dependent children,
Okay.
they're not prepared for that kind of audience.
Okay.
So
I
yes,
will say, oh, go
so
ahead.
encourage, bring your spouse. Obviously, retirement planning involves, a spouse many times. So if you want to bring your spouse to those events, you're welcome to do so. Just make sure if you've already registered that you update your registration then, if you're bringing an additional individual, if you haven't done that, just so we can plan for space.
And I will say, I mean, I went to, again, a couple of the planning sessions, and I mean, I've been impressed so far. So I hope these will be something, that our university hasn't, our employer hasn't offered for us, which lots of other employees have. And so I think this is a new benefit that is a positive. So,
Yeah, and I think our goal is to evaluate, see how it goes this year, and if it's well received and good information, that we would offer it on a more regular basis.
and I think you have quite a bit of sign up, right?
Yeah, we've got a couple dates that we've maxed out on our space. We've had to expand the seating in the rooms we had reserved. So the evening sessions are fairly open still, but those midday sessions are pretty full.
Great.
Yep.
I think Lisa probably just still has her hand up. I'm guessing if it's a new question, pop back on, Lisa, but any other questions?
So Amy, I'm just going through my list, and I know Erica probably does as well. So we owe you a priority contact. Yeah, I know it's in the open enrollment guide, but we will give you an email with the priority contact, the TIAA contact, the email that we'd prefer inquiries go to from the benefits team, and then Diane's question on the refraction coverage, and then the OUWB designation on eSpace. We'll follow up and see what we can do there.
Okay, and so I'll wait till you guys send me a copy of the slideshow with sort of a contact page added or something.
Yeah.
And then I will email out the link to this recording and I will email out the slideshow.
Yep, sounds great.
Okay. Anybody have any other questions? Oh, 1 second. Hold on. Let me just see what's. I don't know what that is. Do we have things like this for 2026? What's this?
Yes, we are
Oh, we
working
will.
to get those just based on timing. Again, that's based on the plans have to get them to us. Once we have them, they will be out there. Sometimes that's closer to the beginning of the year. So it's up to Priority Health and Blue Cross. We will definitely have those out there this year.
And those are mandated by law, right? I'm pretty sure.
Yeah, the SBCs will be posted next week. So we'll have SBCs. We are still waiting for them, but we will have them.
Question, are FSAs tied to insurance? Do you have to have a particular medical insurance to qualify for using an FSA?
Go ahead.
No.
No. Yeah.
No,
Yes.
yeah, you cannot contribute to a healthcare FSA and a health savings account. So there are other savings accounts that you're precluded from contributing to if you participate in a healthcare flexible spending account. But no, there's not a requirement for a medical plan to contribute and use healthcare FSA dollars.
Okay. Other questions?
All right, great. Well, thanks everybody for attending. Hopefully it was informational and thanks
Perfect.
again.
Thank you
Great
for your
day.
time. Thank
Great
you,
day.
Ashley and Erica and Eric.
Yeah, thank
bet.
you, everyone.
Bye.
Take care.
Bye.